Good morning. This is Melody Paisalt from the Healthcare Authority. We'll get started in just another minute or two as folks get launched and launch the webinar or get logged in. So please be patient with us and we'll get started in just another minute.
Can you hear me at all?
Can you do an audio test for us, please?
Good morning.
I can.
Can you hear me?
Good morning, John. How are you doing?
Okay, good. Good. My phone disconnected, so I think now I am set up.
Awesome. Welcome. Thank you again so much for doing this. And for the folks on the webinar, we'll get started in just another minute or two as folks get logged in. So John, thank you again so much for doing this morning.
It's no problem. Thank you.
Good morning to everyone on the webinar series. We'll get started in just a few more minutes as folks get logged into the webinar. We have provided a copy of the handouts that John will be going over in the drop-down menu if you'd like to download those ahead of time. Again, welcome to our monthly webinar series on criminal justice and behavioral health web interface. Welcome to our webinar. Good morning. This is Melody Paisalt from the Healthcare Authority and the Division of Behavioral Health and Recovery. Welcome to our Behavioral Health Recovery, Criminal Justice, and Behavioral Health Interface series. We'll get started in just a few more minutes. So if you're not familiar with GoToWebinar, we are going to go through a few slides that just show an overview of GoToWebinar. If you want to ask questions verbally, we really encourage you to click on the audio pane and choose the phone dial-in feature. We get a lot less feedback when you use the phone option. So if you want to ask your questions verbally, please use that audio. Also, this webinar is being recorded and will be posted to the Healthcare Authority website at a later date. We have made the slides available on the handouts portion of your GoToWebinar menu, and you can download those now. So please make sure and refrain from any questions that might disclose any private or confidential information. Again, if you're not familiar with GoToWebinar, you have a menu, and that menu has several different options, including an audio pane, and you can choose the computer audio or a telephone. And so we do see a lot less feedback when you choose the phone option instead of the computer audio. You can raise your hand to ask questions and make sure that our audio is doing well. So if folks could raise your hands now just to let us know that we are coming in loud and clear. Awesome, thank you very much. And now if you could click on your hand again, that will lower your hand. When you go to ask a question, we'll be looking at having you raise your hands if you want to ask your question verbally. If you don't want to ask your question verbally, you can always type in your question in the question pane, and we'll be answering some of the questions. Again, just how to raise your hand, and thank you for everyone that demonstrated. It is a little misleading that the green arrow up means that your hand is down. The red arrow down means that your hand is up. And so just to kind of check in with that. We'll get started in just a few more minutes. So again, thank you all for joining, and welcome to our webinar. Good morning, everyone. This is Melody Paisalt with the Healthcare Authority and the Division of Behavioral Health and Recovery. Welcome to our Criminal Justice and Behavioral Health Interface webinar series. We'll get started in just another minute or two as folks are still logging in. We had a wonderful showing with over 300 people registered, and so we'll give folks some time to get their webinar platform loaded up into their computer. So again, welcome to our monthly webinar series. Well, I want to be very mindful of time. It is right at 8:32, so we want to go ahead and get started. Just a little housekeeping before we launch the webinar and turn it over to John, our presenter this month. The Division of Behavioral Health and Recovery started meeting internally with some of our sister divisions at the Healthcare Authority and talking about all of the different pieces of the Healthcare Authority that are working either with individuals or working with systems that touch the criminal justice system. And so we decided we wanted to learn more about what each other does, as well as what are the different programs and resources that are out there to serve individuals predominantly on Medicaid that may be having that behavioral health issue and touching the criminal justice system. And so we decided to launch a webinar series predominantly to educate ourselves about all of the different programs. And we thought, let's take this and open it up to the communities to learn about the different programs, services, resources, where behavioral health and criminal justice intersect. And so we launched the webinar series in January. This is our 4th webinar, and so we do have those archived. If folks would be interested in knowing the archived webinars, we do have those available. We also will be holding these monthly, the last Wednesday of every month. And I actually do not have the next webinar at the tip of my fingers, but I will try and do that by the end of the webinar series. So by the end of today's webinar, I'll get what next month's topic is. So just again, a disclaimer, this webinar is being recorded and will be posted to the Healthcare Authority website at a later date. We have already uploaded the handouts, and you can download the handouts from today's presentation. And so that's already available. Again, just to be mindful, please don't talk about any particular individuals or private or confidential information when you go to ask your questions. If you're not familiar with the GoToWebinar controls, you have a menu that has lots of different options on it that can be retracted and expanded using the little orange arrow. We do encourage, if you want to ask a question verbally, that you choose the telephone option. We get a lot less feedback if you use the telephone option instead of the computer audio. If you want to raise your hand, and we did have a demonstration making sure that everybody could hear me, asking people to raise their hands and lower their hands. Thank you everybody that did that. I want to make sure that we're continuing to be loud and clear as we present today's information. If you do want to type your question, if you're shy and don't want to talk verbally, you can also type your question into the question pane and we'll get to those as well. Again, this is a little bit of a counterintuitive around the hands, that the green arrow actually means your hand is down and the red arrow means that your hand is up. And so with that, I'm going to switch slides really quick and start showing John's slides. So John McGrath is our presenter today, and he's with the Washington State Sheriffs and Police Chiefs Association, and he's the jail services liaison for WASPC. In John's role at WASPC, he provides technical assistance, mentoring, and research analysis for jail administrators across the state. He also administers the Mental Health Field Response Team grant. John has worked in law enforcement for a combined 24 years in California, Idaho, and Washington. And before he joined WASPC, he served 13 years as the jail commander of the Spokane County Detention Services. So we're very glad to have John today because he is one of our partners on the True Blood implementation plan of the True Blood settlement agreement. And so we work very closely with John. And John, thank you again so much for your time today and sharing information about the mental health field response. We also fondly call it the CoResponder program.
Thank you, Melody. I appreciate that. Well, good morning, everybody. I thought I would just get started and say a little bit about WASPC. I think it's sometimes misunderstood that WASPC is an association and not necessarily a state-run agency. You can give me the next slide? Or do I have control of this, Melody? You
will have to say next slide, sorry.
Okay. So WASPIC, the Washington Association of Sheriffs and Police Chiefs, founded in 1963, consists of an executive director and top management personnel that have a previous law enforcement background from state agencies. Our membership includes former and current sheriffs, police chiefs, members of the State Patrol, Department of Corrections, and representatives from a number of different federal agencies. We do have a governing board made up of those individuals that serve as our executive board. WASPIC is the only association of its kind that combines members of law enforcement from local, state, tribal, and federal law enforcement agencies into one body. Our function is to provide specific materials and services to law enforcement agencies and the state members and non-members alike. Melody just mentioned a lot of that work that I do for jails is technical assistance and research. This grant that I administer is just a collateral duty to make sure that WASPIC's providing the best services we can. The mission of WASPIC is to lead a collaboration among law enforcement executives to enhance public safety, and you'll see in here, I think, WASPIC at a lot of different state committees and other state agencies in collaboration of the work that's being done in law enforcement and for public safety. Next slide. So in 2018, WASPIC was selected by the legislature to lead as the lead organization for what was to become the mental health field response teams. And I think Melody mentioned there's a number of different state CoResponder programs. So we're just one of those that's funded through the legislature. And our goals, much like the others, are to provide treatment and diversion for persons who have behavioral health issues in the community. And the ultimate goal is to reduce incarceration. We really want the persons who have these behavioral health issues in treatment and diversion and not filling up jail beds where it's really unnecessary. Next slide. So my predecessor, many of you may know Ned Newland, was the jail services liaison. I joined WASPIC last February, and so he put together, when the grant was given to WASPIC, he put together the criteria and the process. So these are some of the processes that WASPIC had determined would be part of the grant, that the applicants had to be a law enforcement agency, that their proposals had to incorporate at least one mental health professional, and that mental health professional had to be licensed in the state of Washington, but also they could be used in the field or on call. And when we go through the slides, you'll see different programs are using these people in different ways. They can also use the mental health professional to help provide training to the agency. A lot of them are using them for CIT training and other just mental health training to patrol. And then the grant allowed for one or more agencies to submit a grant. So there's a number of agencies that actually joined together to best use services. A number of them used and contracted with the same mental health providers already, so it made sense that they combine in this grant proposal. Next slide. So any agency that had an existing program or didn't wanted to start one could apply. Agencies had to develop training for their mental health professionals as they incorporated them into their patrol agency. They had to coordinate with their 911 so that as calls for service came in, whether they were using somebody in the field or they had somebody on call, they had to coordinate how that information was going to get to the CoResponder team. And then they had to use a standard set of data reporting elements, and we'll get into data here a little bit. I'm sure there's a number of questions about data specifically. But then they also had to provide this monthly reporting on their state status, as well as any anecdotal stories that they might have. Next slide. So data with WASPIC has been a little messy. and we'll get into the reasons why here shortly. But if you show the next slide, there are some general data fields that we've selected that everybody is required through an app to provide. So just includes basic information about the incident, the officer, the nature of the call, and then what are they observing when they get to the call, any injuries or uses of force that may have been used, the disposition of the call, so were they sent to treatment, were they diverted in some other way, or did they end up in custody, and then a narrative about obviously what the call was about. And next slide, please. So this is where our data gets a little messy. So the original company hired in 2018 to provide the data app was called Ride Along. And they began the process to set up the app that every user had. And then they also worked with the agencies to provide an interface so that they had access to their reports. Washtec doesn't need access to all of the reports, so we need to make sure that there was some separation. So the interfaces were very important. Ride-along began to have issues in late 2018, and during that time, they ended up going into negotiations with a company called Open Lattice, and in just the middle of 2019, Open Lattice acquired Ride-along as a new agency. During that time frame when they were going through these negotiations, Ride-along and Open Lattice really didn't do any work for us. So the issues that we had with the app or interfaces that wasn't working or was a little clunky frustrated our users, and they ended up really stopped using it. Some did, some didn't. Those that didn't started reporting in Excel. So our data was designed obviously to be in one location, and that got a little haphazard as the app had its problems. The app is now functioning correctly, and users are working with it. Next slide, please. I'm going to talk a little bit about the grant award process and the appropriations that were given. You can show the next slide. So like I said, the first grant started in 2018, the fiscal year 2018-2019. The legislature approved $1 million, and roughly they wanted about 8 to 10 agencies across the state, at least one from east and one from west side, to be included. In fiscal year 1920, there was legislature approved $2 million, but restricted $1.5 million to True Blood Phase 1 agencies like Pierce County, Spokane area, as well as Southwest Washington. We're set again in 2021 for the $2 million with, I believe, the same restrictions. And the reason I say it's pending is that we do expect the grant to be funded, but we understand that it's part of the budget that could be reappropriated because of the pandemic. It's my understanding that the legislature will be meeting here before the end of June so that they can decide what they'll need to reorganize the budget. But our current process is to move forward with the 2021 process and fund agencies going into the next fiscal year. Next slide. There's just a look of who the agencies were in the 18-19 fiscal year. These are the same agencies that ended up going into 19 and 20 as well, and we added a couple that we'll get to later. But as you can see, there were 3 joint agencies, and just as Renton and Auburn were getting started in 2018, they ended up not being able to secure a contract with the mental health provider that provided the right service for them. So they ended up pulling out, and that $90,000 was redistributed to some of the other agencies that you see there. And you can see that they kind of are representative of East, Central, and Western Washington. Next slide, please. So I thought I'd just step through these agencies since there was options for what agencies could do, whether they had a CoResponder embedded in a patrol car or working in the agency, or was that on the phone with their behavioral health company, or even some agencies put that person in a central location at one of their patrol stations. So Kirkland was a joint agency with Shoreline, Kenmore, Lake Forest Park, and Bothell Police Departments. They had an expansion of what they called a radar program. The Response Awareness and De-escalation and Referral Program was already working, and the WASPIC funding was to help kind of solidify that program and make sure that their shifts were covered. The goals were to enhance their community and first responder safety, reducing uses of force, and strengthening their partnerships in the community. I think they did provide vital assistance to persons involved with behavioral health issues. Their mental health professionals work side by side with the officer and provide immediate crisis intervention, or at times some more sophisticated diagnostic assessments and follow-up. The MHP provides coordination with long-term community support and oftentimes reach out to family to help with their loved ones. The model allows for the family as well as the individuals to understand what services are available in those communities, and they become better advocates, reducing incarceration, obviously. They use three radar Navigator MHPs. They're funded by this grant, and that took the place of what they called volunteer shifts. So it was really giving persons with doing this work more security with being helpful in the community. And that helps cover all 5 of those departments. Next slide. So this is a kind of combination of what the results were for the 2018-2019 work that Kirkland and those agencies performed. I think so they had 226 contacts. I think that's pretty significant for those small communities, especially with the number of hours that they were working. Next slide. So the Kitsap County Sheriff's Office subcontracted with Kitsap Mental Health Services for DCR, a designated crisis responder. And they're one of the agencies that put that DCR in one of their substations in Silverdale. And that was the midpoint for their area. So that person was kind of in between all of the happenings of Kitsap County. The DCR was available for calls directly. 911 would funnel those calls to the DCR, and then the DCR would provide assistance to the officers during the call and help them assess the issues, and then provide assistance in where that person needed to be further evaluated or sent for treatment, and then able to help divert those people when necessary or provide other linkage to diversion alternatives. Kitsap County has access to a number of different short-term alternatives, the Kitsap Recovery Center Detox, several shelters. They're facilitating outpatient treatment through walk-in process at KMHS. Calls to persons existing case manager could happen during the call, or a visit by a peer specialist. The overall relationship with the patrol officers and the DCR has been reported as very positive, and often because of the favorable outcomes that they receive. If you go to the next slide, we'll talk a little about their outcomes. So we have the roughly 207 total contacts, and a contact in all of these is defined as somebody that they've encountered for at least 25 minutes or more. You'll see a number of follow-ups throughout the other agencies. They have time. The majority of the agencies are able to reach out to individuals that they have contacted and make sure that their treatment is ongoing, and that further helps keep people diverted from incarceration. Next slide. the Olympia Police Department partnered with Catholic Community Services of Olympia to create the Familiar Faces program. OPD had walking patrol officers already, and so they began contacting persons in the community that they were well aware of that needed assistance, often being arrested for nuisance crimes. So their goal was to make sure that those persons had access to crisis recovery and behavioral health treatment on an ongoing basis. They've done a number of other things where they've created persons that need housing and other opportunities, the wraparound care. I think it's on the next slide. They have 2 peer navigators. They carry a caseload of 10 to 15 participants. They kind of cycle through the program and graduate. The peer navigators are persons that were previously incarcerated, and so they're able to share their individual life stories, and helps create trust and respect and empower the persons to improve their own personal situation. They did receive an award by the Association of Cities, Municipal Excellent Award last year, so that because of their work in Olympia. Next slide. The Redmond Police Department, it uses ICRON of Greater Seattle to work in their mental health program. This was achieved by ensuring that a mental health professional was an active member of their team by joining the team in the field to respond to calls. So this person is embedded in the patrol car with the police officer. The program aimed to divert individuals at the earliest opportunity into community-based alternatives, crisis intervention, screening assessments, and referral to treatment long before the arrests were made. The partnership with ICRON as well as the access to the Community Resource Center, has ensured that the department could provide both rapid response and immediate intervention to access to a full array of other services the patient might need. It's a very intentional effort to make sure that the person has access to a wide variety of support services and keep that person from custody. Next slide. So Redmond had a contact totaling about 263 persons. They diverted 29 from jail and 18 from the ER. So they had a lot of work going on in Redmond, and Redmond is in a really good position in that, just to highlight them, they're looking for sustainability. So while we funded the grant in 18, 19, and 19 and 20, their goal is to become self-sufficient so that this becomes part of their ongoing patrol work in Redmond. Next slide. Port Angeles has done a lot of great work. They partnered with the Olympic Peninsula Community Clinic and designated a coordinated response program called Rediscovery. It addresses the needs of persons with behavioral health issues in their community. They embed the social worker with the officers. They had a lot of persons that they, like Olympia, they know the community, a lot of persons that had a lot of contact with, so they were able to reach out to them first and actually keep track of them so they didn't keep getting lost in the red tape of mental health. The program just partners with the Olympic Peninsula Community Clinic, had already existed, so this grant helped fund additional resources and time. They had also had a grant from Spokane County that allowed them to improve this response. The program covered just over 2,000 individuals between June of 2018 to May of 19. They had a lot of contacts. They had the most contacts of all of our grant recipients. The objective has been to expand resources available to the program in the form of additional trained staff and coordinate those resources between the police department, the clinic, the fire department, and the Spokane County Sheriff's Office, as well as Sequoia Police Department. Slide. Here's a little breakdown of some of those 2,000 persons contacts. A number of those contacts were obviously them following up. So they had a lot of, while they had contacted new individuals maybe once, or just individuals once, the follow-up, I believe, in Port Angeles was something they should be very proud of. Next slide. So Spokane County Sheriff's Office partnered with Frontier Behavioral Health, and they have a co-deployment team with the deputy, embedding that mental health professional in the car to provide the services in Spokane Valley as well as Spokane County. They focused on housing, and Frontier Behavioral Health was able to incorporate 3 different respite resources to help them on a 24/7 basis. I will note too that even though when the co-deployment team wasn't on duty, Frontier Behavioral Health allowed other patrol officers to call directly to Frontier Behavioral Health to provide the same resources, and then those calls that were taken while the staff were off duty were given back to them when they came back on their next shift so they could do follow-ups as well. They also reached into the facility, the jail, and began meeting with persons who were already incarcerated. Knowing they were going to be released to the community, they started making contact sooner so that they could ensure, along with the mental health staff at the jail, that the persons that were being released had access and any kind of structure needs, transportation or whatever, could be worked out long before the person was released. That was also in coordination with the public defender's office and like I said, the jail mental health staff. They were contacting True Blood class members in the jail also to create a plan to include housing, medication, and other resources. So it wasn't just persons in True Blood, but others as well. Next slide. So on the first grant cycle, they served approximately 250 individuals. 82% of them were diverted from the jail and emergency rooms. 5 persons had been incarcerated, and another 39 had actually needed to go to the ER. We'll note just on Spokane, a number of agencies are keeping, like I said, they have their own Excel spreadsheets at times, so they're keeping track of a number of different things for the agencies themselves. I think Spokane does a really good job of keeping track of time, and so how much time is saved when a patrol officer is able to work patrol, and the co-deployed team is able to just specifically go to these calls for service. This last month in March, they were able to divert 98 people from the emergency room, 2 from the jail, and 41 didn't require an ambulance. Their total time saved has been 40,933 hours that has allowed the patrol agencies to work in patrol, and then allowed the co-responder teams to take care of these calls, which can, as you may know, last a lot longer than a regular patrol call. That can be on scene for an hour or more, just trying to get resources available and make that situation a lot better. Next slide. So Wenatchee PD is the lead agency of this multi-agency grant with East Wenatchee PD, Chelan County Sheriff, and as well as the Douglas County Sheriff. Theirs was also an expansion of a program that had already been in place. They had partnered with Catholic Charities Serving Central Washington to provide their response. Catholic Charities remains the contract provider for the crisis and mental health services for Chelan and Douglas counties. So it was a great fit into all of these agencies that were already using the services that just needed to be more focused. They began their focus on high volume contacts, persons they knew, and keeping them diverted from into behavioral health services instead of jail or the ER. They had started with one staff member and were able to, with grant funding, expand that into a small group of people that served those agencies. The funding provided by the grant allowed them to increase their service hours. They went from just a few days a week to 7 to 3 Monday through Friday, and working 8 hours. They were trying to hire a lot. The issues people have, obviously, is trying to hire staff. So while they couldn't fill all of their shifts, they just started using persons from Catholic Charities on the overtime, and that helped them fill the role and actually determine a better schedule for everybody by not having to fill those positions. So they ended up saving some money and looking at new staffing models that help provide the best service to the calls based on the call volume. Next slide. So their DCRs made about 311 contacts of patients that had been involved in law enforcement calls. The critical growth, I think, for them was reaching out into the outlying areas of Chelan and Douglas counties that had never seen or had responses in the past. Just staffing wasn't available. So they pointed out that Mansfield in particular saw its first DCR contact because of this funding. Extended hours helped make that possible, so they were able to reach those outlying agencies on a regular basis and provide follow-through and follow-up. They used scanners, so their DCRs are not in the cars. They're driving in their own vehicles, so they're able to go to and be in places where law enforcement may not need to be. So they're still providing contact, and then they follow up with law enforcement after, or they're waiting before law enforcement gets there. So they're sometimes waiting, knowing that they're going to be needed. Next slide. So for the 2018-2019, some of the biggest issues, and they haven't gone away, it's just hiring mental health professionals to do the work. It is very hard to come across and get somebody through a background process, even as a law enforcement officer, let alone adding the mental health credentials. We had obviously those delays in creating the data collection tool and created issues with our data, and mostly because those issues with those two companies. Next slide. There we go. So looking to the current grant cycle, 19-20 fiscal year, I mentioned a little bit earlier, there was $2 million. 1.5 million was designated for those troop-led regions only, which left 500,000 to the mental health field response grant for those agencies that were not in those troop-led areas. Next slide. So here's who was funded. The original agencies were funded, and while they had requested funding to expand their programs with 500,000 available, it was really difficult to expand the programs. So those funding that they received was really to keep them in status quo and continue the good work that they were doing. Pierce County and Vancouver PD came into the process as troop-led agencies. We'll get into their programs here in just a minute, but Spokane County Sheriff and Spokane Police Department merged their two programs to help better collaborate in that community. Next slide. So since those other agencies had previously been funded, and we just talked about all of their contributions, I wasn't going to reiterate what they're doing in 2018 or the 2019-2020 fiscal year. So we'll just go over the three True Blood agencies. So Pierce County has embedded their deputies in the precincts and attached throughout the county. They have their own vehicle and can respond to incidents either with patrol or without patrol at times for better coverage. They assist with de-escalation. Obviously, their most important goal is to reduce incarceration for persons who don't need to be in custody. The funding provided by WASPIC helped this existing program establish better shift coverage, and their goal was to expand into the region and begin providing regional services and not just a Pierce County Sheriff's Office call. Next slide. So again, their challenges, one of the main things that probably most CoResponder programs is having the inability to hire people quickly and find the right people to do the work. And so prior to this pandemic hitting, they had a couple applicants in the background process, and hoped of hiring in May. That's obviously been sidelined a little bit, but they're still trying to move forward, and hopefully within the May timeframe, they'll be hiring that person. That's the person that WASPIC has funded, so their inability to hire has hampered their ability to provide services based on WASPIC funding. But they're hopeful that they'll get that person filled. Next slide. So Spokane Sheriff had already had their program in place, and Spokane PD also had a very similar program funded by different True Blood dollars. So as they spoke and worked together to collaborate, they felt that by merging those two programs together, they could provide better service to the county itself and really getting rid of any kind of boundaries. So a co-deployed team covering almost 24/7 could be called from one side of the county to the other, and it could be the sheriff that shows up, or it could be the police department. They've branded themselves as the Behavioral Health Crisis Response Team, and so their uniforms are a little bit different and their vehicles look a little bit different to show that that's the work that they do. They both had worked with Frontier Behavioral Health already, so that actually helped Frontier Behavioral Health as well with contracting and services and staffing, so that they could fund and help provide better coverage to the two agencies. Next slide. So again, the theme of the day is just hiring co-responders has been challenging. They too had people in the background process waiting for May hires. Some of those were just getting out of college and graduating. So that too has been kind of hampered by the pandemic. But they're filling their shifts with overtime, and Frontier Behavioral Health staff is working overtime as well to fill the shifts that are vacant. Next slide. So Vancouver PD partnered with Clark County Department of Community Services Crisis Services Program and CMAR Community Services Northwest. And the county had already had their mental health field response team working. And so Vancouver PD was able to help collaborate with them and help them provide a better response to the city of Vancouver. Their program is modeled just like Pierce County's, and same obvious goals to provide better community-based crisis intervention and to keep persons out of the criminal justice system. So on the next slide, Vancouver had a really tough time hiring, not just for mental health staff, but also they had people who were at the county behavioral health organization that had left employment that were leads in this grant. So they had to find and replace key persons. They had a number of issues with local agreements that took probably way too long to negotiate. And then when the pandemic hit for Vancouver, all of the work that they did and had slated to put in place stopped, and they ended up having to pull out of the grant, realizing that with just a few months left of the grant cycle, they were not able to get anything off of the ground. So they'll be looking to pick this back up after the pandemic and into the next fiscal year. Next slide. Which brings us to the next fiscal year. So obviously the agencies are having a really tough time just providing services and trying to hire staff in unprecedented times, obviously. So one of the takeaways from the last grant application process was that it was a little late in the process. It was already into the new fiscal year. So we had planned to have applications and interviews held in April of this year, which we ended up needing to cancel, obviously. So to streamline the process and to continue to provide the services in the way that they are now, we decided that the applicants that were already receiving funding would continue to receive the funding at the level it was given in the last fiscal year. And beginning in 2021, they'll have their existing funding. That way they can continue to hire the staff that they have in process, and we won't have too many delays as we did this last year trying to get them up and running. So on the next slide, it just reiterates the grant funding for each of the agencies that will begin in 2021. We've reached out to all of these agencies. They're all willing to pick up where they've left off and move forward to continue to keep their programs operating in their communities. And with that, I'll take any questions that you might have.
John, thank you so much for all of the great information about all of the different communities in Washington that are implementing the mental health field response or CoResponder program. My colleague, Tony Walton, has asked to, wants to ask a question. So Tony, I've muted you. Unmuted.
Yeah, good morning. Thank you. Yeah, good morning, Melody, and good morning, John, and everyone that's on the call. I just had a quick question kind of around criteria for at what point does an individual or a co-responder respond to a situation? Is it strictly when somebody is actively decompensating, or is it as broad as like an opioid overdose where it might not be strictly mental health related, but there could be a co-occurring element there?
I think when there's a co-occurring element that would cause, self-harm issues or harm to others, that's when they would be dispatched. Does that help answer that question? So I wouldn't think it'd be in every case, but I think when the person's behavior that they're exhibiting requires, more clinical experience, dispatch is going to field those calls directly to a co-responder.
Okay, thank you.
You're welcome.
Thanks, Tony. Thanks, John. Brianna asks, when can new agencies apply? Our county has a True Blood program. Do we include them in our program, ?
So like I had just mentioned, we're not having an open application process for the next fiscal year 2021. We're just going to keep everybody funded. It's just, I think, very difficult to bring agencies together during this time frame and ask them to provide a presentation and create the process. There may be additional funding available as the fiscal year begins, that we would reach out to new agencies, either to provide technical assistance to provide to build a program or apply for a new co-responders to be added to our program. But at this point, we're just going to maintain status quo for the next fiscal year.
Great, thank you.
And Melody, I don't know if
go
she
ahead.
mentioned True Blood funding. She had mentioned True Blood funding, so I'm not sure if there'll be additional True Blood funding available for other agencies through other programs next year. I don't know.
I think it might be a good topic for our May webinar is to do an overview of True Blood and where we're at with implementing all of the projects in True Blood, so that maybe that can be our topic in May. So that sounds like a good segue to what our May webinar series may need to address. So that's a great question. Ed Crawford, I'm going to unmute you.
Muted.
Would you like to ask your question?
No, I'm sorry. I pushed the button on accident.
No problem, thank you. How about Katrina?
Can you hear me?
Yep.
All right, my name is Katrina Kessler. Yeah, so thank you for all the information. It's fantastic. I didn't know anything about this program. I'm a psychosocial researcher, so it caught my attention that in the Port Angeles statistics, 20% had refused services. And I was just wondering if they're collecting any data on the reasons why some people are refusing services, and is it only Port Angeles that is actually tracking that information?
I think in the disposition section of our app, it talks about the options for refusing treatment. I think that's actually pretty common in my experience in law enforcement. You'll find a number of people that just don't want anything to do and will continue to be with their behaviors. So I think call by call in that 21%, I believe in the disposition section of each of that calls, there would be reasons why, at least narrated.
Oh, okay, so they are documenting the reasons. Is anyone doing anything?
Yeah, so sorry, go ahead.
It sounds like they are generally documenting reasons why people sometimes refuse the services offered. Do you know if anyone is doing anything with that data?
I'm not sure. I'd have to check with the behavioral health care agencies that are helping collect that data to see if they've done anything with it. I'm not sure.
Okay, thank you.
Absolutely, thank you. I'll follow up with that.
Thank you so much for your question. Just a reminder, if folks want to either raise your hand or type your question into the question pane, we actually have quite a few questions in the question pane. So John, here's a question from Elizabeth. Hiring staff seems to be one of the biggest issues. Are there any ideas going forward on how to either change the requirements, offer more incentives for prospective hires, or help people who might have limited resources to get the required credentials in order to fill these positions?
Some of the conversations we've been having involve around like pre-hire and pre-training. Sometimes they'll get somebody through the process that meets all the criteria, and then once they get into the patrol car, they're like, this isn't for me, so I can't do this. So we've wasted time and energy there. So we have a couple agencies that are recruiting, and when they recruit, they kind of do an indoctrination before they get started, or even during the background process. I know some of the agencies have reached out into the colleges before those that are getting ready to graduate and just, are just waiting for the graduation date. They'll go ahead and pre-hire them so that they can begin their training and background, and then hopefully by the time they graduate, get into the field. We have talked a little bit about relaxing the certification levels. The legislature has not been willing to do that at this time. And as far as incentives are concerned, the agencies have talked about it, and their their budgets that they've and proposals are theirs to really to work with. So if they wanted to provide incentives or bonuses as they're hiring people, that's something that's allowable in the contract.
And I actually, Steve Perry is the Behavioral Health Workforce Program Manager at the Healthcare Authority and the Division of Behavioral Health and Recovery. And there are quite a number of initiatives to try and increase the behavioral health workforce. So if I can, I don't know if I can put Steve on the spot and unmute him and see if he wants to add anything to initiatives in order to increase the behavioral health workforce. Steve?
Thank you, Melody. There are a lot of things going on, nothing specific to True Blood that I'm aware of at this point, but a lot of work around licensing and certification, being able to work electronically, particularly in time of COVID, which may help with some of the ability to be in remote areas, things like that. I can't think of anything else off the top of my head, though.
There's some work at DOH around reciprocity, and I know the Accountable Communities of Health, or a number of the ACHs also have some workforce initiatives. There's also, I think, the State Workforce Training and Education Board that's really trying to bring attention to the behavioral health workforce shortage. And Steve, I know that you're working closely with DOH and the Workforce Board on how do we create a pipeline of workforce, behavioral health workforce too.
Yeah, there's a lot of work going on around health workforce issues, behavioral health workforce issues, a lot of partners at the table. Some of the more recent activity is around getting data from the Employment Security Department on health professions or professionals who are unemployed during this time of COVID, trying to get a sense of what occupations those represent, what geographic areas they're from. And I think as that conversation moves forward, it'll be an opportunity to talk about whether or not some of those affected workers can be redeployed into positions either within their region or in terms of being able to provide service electronically, either through telephone or other forms of technology. I know that, for example, crisis lines are overwhelmed right now, and HCA had a team working on a FEMA grant, which they were successful in getting. And I think the hope is to deploy up to over 100 crisis line workers. And so that could be work that could be done from home. So if healthcare professions are laid off because they're taking care of family members or children or something like that, there may be an opportunity to redeploy. So a number of efforts, also looking at criminal background checks and how that affects people's ability to get into behavioral health occupations. There's a lot of work during COVID around lightening up licensing and certification requirements that I think have created additional workforce capacity in Washington State. And I know there are a lot of conversations going on right now about the additional flexibilities, both at the federal and state level, and how those flexibilities have increased behavioral health workforce, and whether or not we can maintain that post-COVID.
Awesome. Thank you, Steve. Patricia asked a question for John. When someone refuses mental health and MHP, mental health professional services in the CoResponder program, are they then taken into custody?
Honestly, that would depend on the nature of the call. Were they called just because of behavior, or were they called because they acted out in a way that there was a crime committed. There's a number of agencies that have worked with prosecutors on diversion. So when a co-responder team shows up, they have some discretion of whether or not they could arrest somebody or just put them into treatment. If somebody's refusing treatment and it is a crime, then they would be arrested.
Awesome. So Michael's asking, where can people find more information if they're interested in building a program, and would they contact you at this number?
Yeah, that's fine. I'm not sure what else is available around the state. I know when my predecessor, Ned Newland, looked at the criteria to come up with WASPIC's version of the co-responder program, he looked, I think, mostly to Colorado. They had a lot of good work being done there. So a lot of the criteria and the focus that we put into the program came out of that state.
Awesome. Do DCRs carry a caseload on individuals they check on periodically?
I believe in some agencies that they do. Really, when you look at like Port Angeles, they keep those people pretty close to them, so their caseload's pretty high. Kitsap County, I believe, does the same, where they're keeping track and following up and following through with some of their persons that they've contacted.
And another question comes in around youth. When a co-responder or a law enforcement responds to maybe a youth in a mental health crisis, do you respond differently to youth in crisis?
I believe so. Yeah, I believe you would respond to a youth regardless of a crisis or not. I would hope that you would. But yeah, so the mental health professional obviously being there with the officers, a lot more beneficial in those types of situations, especially when the youth are acting out. Provide the care that they need and the guidance. With a lot of the co-responder programs changing their look in a sense of they're not wearing standard police uniforms, softer uniforms help de-escalate as well. So I think those things combined help with those type of situations.
Awesome. Thank you all so much. We are at the end of our time, and I want to be mindful of everybody's time. So we didn't get to everyone's questions, and we'll try and circle back and respond to your questions. John, thank you so much for your time today and I know you were actually supposed to be in Hawaii. So we appreciate you being here with us and sharing all this great information today. And there are some questions coming in about True Blood. We may try and make an overview of True Blood, at least the settlement agreement, as our topic for May. There also, I believe, is a webinar coming up just on an update on implementation of the True Blood settlement agreement projects. And so we'll try and respond back to everyone about an update on that webinar. Thank you all so much. Again, the webinar handouts are available to download, and we will be posting this information at a later date, a recording of the webinar and a copy of the slides on the HCA website. Thank you all so much. We'll be ending the webinar now.
Thank you.